Assalamu alaikum. So today we are going to study bipolar and related disorder, and according to DSM-V-TR, bipolar and related disorder have been categorized into 8 key types, and all types are very important, but we shall be keeping our major focus on first 3 types because these are more prevalent compared to rest of the 5 types. So let's get started. And First one is bipolar 1 disorder. The criteria for bipolar 1 disorder, or you can say for a diagnosis of bipolar 1 disorder, it is necessary to meet the following criteria for a manic episode. Like manic episode may have been preceded by and may be followed by hypomanic or major depressive episodes. Like in bipolar 1 disorder, the first criteria which is most important is the occurrence of manic episode. Manic episode must be present lasting at least for 1 week. If a person is reporting a manic episode since last 1 week, so we can give him diagnosis of bipolar 1 disorder. And now what do we mean by manic episode? It means a person must be reporting inflated high self-esteem or grandiosity. Is another symptom you can see decreased need for sleep, like they get fresh within 3 hours of sleep, and they feel more talkative, and talk like they have pressure to keep speaking. Furthermore, they also manifest flight of ideas, like they one thought is racing over the other. They are talking about one thing and suddenly they will jump to another topic. They have distractibility, like they cannot keep their attention to a single stimuli, rather they will keep shifting their focus from one stimuli to another. Also, they manifest increased goal directed activity, and they show excessive involvement in activities that are high potential or painful consequences. So in manic episode, as I told you, around 7 symptoms, and any 3 or more symptom must be there for the diagnosis of manic episode. But hypomanic and major depressive episodes are conditional. Like a person with bipolar 1 disorder must be having many manic episodes, but maybe he also manifests the symptom of hypomanic episode or major depressive, but maybe he doesn't have both the hypomanic or major depressive episode oriented symptoms, so still we can give the diagnosis of bipolar 1 disorder. So what do we mean by hypomanic disorder? Like the symptom must be present at least for 4 consecutive days, but the impairment in the functioning must not be visible. Impairment in social, personal, and occupational functioning would be not that worst. So again, all of the symptoms would be same, like I told earlier: inflated self-esteem, decreased need for sleep, more talkativeness, flight of ideas, distractibility. Any 3 symptoms can be present for hypomanic episode as well. As far as the major depressive episode is concerned, so at least 5 symptoms of major depressive episode must be present for the same 2 week period. Like what kind of symptom major depressive episode a person with major depressive episode manifest? For example, they show depressed mood most of the day, nearly every day. They show a loss of interest in playable activity, and they lost their activities in daily tasks. And you can see the significant weight lost, and they may complain about insomnia or hypersomnia. Either they will sleep less or they excessively show sleeping habits. And you can also see psychomotor agitation, fatigue, or loss of energy nearly every day. Also, they will report feeling of worthlessness, or maybe they sometimes say they are suffering from any kind of guilt, and also they have the problem to concentrate or take decisions. And very important is that they also report like they are having the thoughts related to death, etc. So any five symptoms would be present, so we can diagnose a person with major depressive disorder. But all these symptoms must be observable by others, or maybe sometime if a person is reporting, self-reporting, so again we can consider it as diagnostic criteria point D. Apart from that, there must be a significant distress and impairment in their social, personal, and occupational functioning. But if there is not impairment in his daily functioning, so we cannot give the diagnosis of bipolar 1 disorder. And his symptoms, manic, hypomanic, or even major depressive episode, must not be due to any substance abuse. He must not be taking any medication, because if he is taking medication or substance, the symptom might be the result of that substance or medication. So again, the bipolar 1 disorder diagnosis wouldn't be appropriate for such conditions. So, when a person fulfills all the criteria of bipolar 1 disorder, again according to DSM-V-TR, you need to specify if the person is suffering from bipolar 1 disorder with anxious distress, like he has some distress because that as a result he's showing the bipolar related symptoms, or he have mixed feature, like sometimes he show hypomanic episode and sometimes major depressive and sometimes manic and major depressive. Is there any mixed feature? Then you are not able to differentiate between two disorders. And is there rapid cycling between manic and hypomanic and depressive episodes? Sometimes he show depressive symptom and frequently he switch from one to another. If there is a rapid cycling, again you need to specify. If he is suffering from only manic episode but there are some melancholic feature, like he sometimes feels sad or distressed, again you need to specify that. If he has atypical feature mean when the representative symptoms are not present. So again you need to specify that he is suffering from mania, so bipolar 1 disorder, but representative symptom like mania, hypomania, or depressive are not clearly present. So you can give these specifiers. And if there are some any psychotic feature with mood congruent and without mood with mood incongruent psychotic feature are there, so you need to again give this specifiers. And if he has some bizarre and odd behavior, you need to specify that. If he is or he or if she is in his pregnancy duration, and due to pregnancy she is reporting any kind of bipolar symptoms, so you need to specify that too. Or if it is due to seasonal effect, so again specification are necessary to make for better understanding and better management plan making. Apart from specifier, it is very important to provide differential diagnosis. As you know, major depressive disorder also, similar to bipolar 1 and bipolar 2 disorder, we also use the same criteria of major depressive disorder in bipolar 1 or even in 2. So you need to specify that here in bipolar 1 and 2 there are mania and hypomania involved, but in major depressive disorder only depression or depressive state prevails. Other bipolar disorder, like as I mentioned earlier, if person is taking any medication or if person is using substances, so maybe symptom can appear. Again you need to differentiate if it is due to any medical condition, any medication, or mental health issues. So and how it is different from bipolar 1 disorder. Again, generalized anxiety disorder, panic, PTSD, or anxiety anxiety disorder also manifests some, manic, not manic but depressive episode. Like in generalized, a person feel anxiety that something wrong can happen. In panic again, they feel something worse can happen. In PTSD, there are symptoms of stress and other disorders. So you need to make clear diagnosis, differential diagnosis, that how it is different from bipolar 1 disorder. Okay, so again, schizoaffective disorder is also, having some mood-related symptom, but there are some delusion and hallucination are there, so we can easily differentiate this category from bipolar 1 disorder. In ADHD, a person, having hard time to keep his attention on one stimuli, and the same is with major depressive person. So you need to, make clear difference how ADHD is different. And in mania, a person experience hyperactivity. So you need to make a clear difference that ADHD is a neurodevelopmental disorder, and there are only attention deficits and hyperactive disorder, but there are not, major depressive symptoms or hypomanic, because in hypomanic multiple other symptoms are involved. So again, disruptive mood dysregulation disorder and personality disorder also manifest some key symptoms of bipolar 1 disorder. So you need to make a clear difference how these are different from bipolar 1 disorder. Okay, the next disorder is bipolar 2 disorder, and bipolar 2 disorder is also very, important, and it is very clear that in bipolar 2 disorder, a person must be having one hypomanic and one major depressive episode. Again, hypomanic episode 3 symptom must be there, and I have mentioned earlier, like a person must be having inflated self-esteem or grandiosity, decreased need for sleep, more talkative, flight of ideas, distractibility, increase in goal-directed activities, excessive involvement in activities that have a high potential for painful consequences. So, among all these symptoms, 3 must be there for a hypomanic episode. And as far as major depressive episodes are concerned, so again, a person must report 5 symptoms, and either for, depressive mood or loss of interest in playable activity. So if he reports 5 symptoms of major depressive episodes, we can give them diagnosis of bipolar 2 disorder. And but this is the condition, these symptoms not due to schizoaffective disorder, which have, other type of symptomatology, and there must be clinical distress and impairment in person's social, personal, occupational life. Otherwise, we cannot give them that diagnosis of bipolar 2 disorder. So again, like bipolar 1 disorder, there are some specifiers which a person must be, specify for better management plan, better prognosis. For example, if a person is suffering from bipolar 2 disorder with anxious distress with mixed feature, rapid cycling, peripartum onset and seasonal pattern, it has the same specifier as in bipolar 1. And in bipolar 1, I have already shared the details about what does that mean. If a person have anxious distress, if he has peripartum onset or seasonal pattern. Okay, the third disorder of bipolar related disorder is cyclothymic disorder, and in cyclothymic disorder for at least 2 years there have been numerous periods with hypomanic and depressive symptoms. Like the combination of hypomanic and depressive symptom must be for at least 2 years, but it should not meet the criteria for a major depressive episode. And full criteria must not be met, but there must be symptoms of depressive, major depressive disorder. And criterion A, like manic and hypomanic and depressive symptom for at least 2 years, but in last 2 months, the symptom must be there, consecutive time period. and the criteria for major depressive, manic, or hypomanic episodes have never been met, which means the complete criteria for any three of them must not be there for the diagnosis of cyclothymic. For example, if a person is having complete manic episode, that means he is suffering from bipolar disorder, because the complete criteria is the sign and symptom or identification of bipolar 1 disorder. If the major disorder is prevalent, so we can say apart from hypomania, major depressive symptoms are there, so we can diagnose it as major depressive. Therefore, complete diagnosis for all three symptoms must not be there, but symptom of hypomania and depressive must be there for at least 2 months. Furthermore, the disorders, there should not be other mental health or medical condition or substance abuse history. Only in that condition we can give a person the diagnosis of cyclothymic disorder. Cyclothymic disorder. Okay, again, cyclothymic disorder also have some specifiers and differential diagnosis. For example, as you can see, we need to only specify if the person is having cyclothymic disorder with anxious distress or without anxious distress. If he has anxious distress, so obviously the prognosis, etiological factor, the treatment plan would be different. And as far as the differential diagnosis is concerned, so again, bipolar and related disorder due to another medical condition. If a person is suffering from cyclothymic disorder but due to another medical condition, so we need to specify that it is not a proper diagnosis or proper disorder, it's just another due to another medical condition. You need to specify if a person is taking any substance or medication. So again, the disorder doesn't fulfill the full-fledged criteria, but it is due to substance medication induced depressive episodes. So bipolar 1 disorder with rapid cycling and bipolar 2 disorder with rapid cycling should be differentiate through cyclothymic disorder, because there must be rapid cycling of hypomanic and depressive episodes, but in cyclothymic the duration must be at least 2 years, so you need to clarify that too. And in borderline personality disorder, as person try to harm himself or herself, so symptom overlap between bipolar 2 1 and even borderline personality disorder. So you need to clarify that in borderline personality disorder there are some other harmful activities involved, but in bipolar 1 and 2 only manic and depressive symptoms are involved. So these were three major types of bipolar disorder. Now, as I mentioned earlier, the rest of the types have some minor changes. For example, if a person is suffering from bipolar and related disorder just because of medication, so you need to give the diagnosis of substance medication induced bipolar and related disorder, but you must have an evidence or having some evidence for past history of medication use. Also you need to specify for how long they were taking medication. Similarly, bipolar and related disorder due to another medical condition. Sometimes it happens the person is suffering from any medical condition, for example, any medical disorder, Alzheimer, delirium, or mental health even disorder. So due to those medical condition, a person experience mood related changes, maybe hypomania or even mania. So in such circumstances, we need to specify that the person is suffering from bipolar disorder. Maybe it is fulfilling all the criteria of the complete bipolar 1, bipolar 2, or even cyclothymic disorder, but it is due to another medical condition. And again, you must have past examination history, like they were suffering from which kind of disorders. Apart from that, other specified bipolar and related disorder. A person must be suffering from bipolar and related disorder, but the diagnostic criteria would not be, completely met. And in such circumstances, psychologist or clinician provide some reasons that the person is suffering from bipolar, but the criteria does not fully met, and therefore we are giving the diagnosis of other specified bipolar and related disorder. Furthermore, it also happens that a person is suffering from bipolar and related disorder, but again the criteria is not fully met. So, but the psychologist or clinician do not provide the proper reasons for the incomplete diagnosis. So, we can diagnose that disorder as unspecified bipolar and related disorder. Lastly, there must be unspecified mood disorder, like they are having mood related dysregulation, but again the clinician or psychologist does not provide the clear picture why he is and why the full criteria are not met. So the diagnosis of unspecified mood disorder is given. So students, these were the bipolar and related disorder, and we have discussed all the 8 categories. And I, as I told earlier, the first three types are more prevalent and more uh, important compared to the other one, because the prevalence of the first three is high in multiple countries. And even you will see the latest statistics that the major depressive episode is prevailing day by day, even in young children and adolescents. So the related management plan and prognosis must be revised time to time. So I think all the disorders are clear to you now, but still if you have any question or any ambiguity, so you can ask your questions. Thank you so much.